Hey everyone, today I just want to talk about PCOS and just the basics. I apologise for being dishevelled. I've just been outside and got completely and utterly drenched. Um, One of the things that I see all the time is that women with PCOS either don't know they've got PCOS and it's really obvious that they do. Even my husband nowadays can say, "Do you think she's got PCOS?" And most times I agree with him. And then I think it's estimated about 70% of women with PCOS don't actually know that they have PCOS. But because it's becoming more apparent, more that term's getting out, lots of people think that they may have this thing called PCOS, but they're not 100% sure. And the doctors really aren't very much help because there still seems to be a lack of knowledge in the mainstream, which is one of the reasons why I've created this group. I've been working in this space for a really long time. I'm getting old, as you can see my greys. So I just wanted a safe space where we can talk about your questions, talk about the research, and try and get answers to what the research actually means for you. So the basics of PCOS come down to just three things. You have hyperandrogenism, which is things like too much testosterone. So you might have infertility, a lack of ovulation, acne, excessive hair growth, things like that. The best way to test is do a blood test. So they'll do something like a testosterone check, and then you need a free androgen index, which basically means that they need to see whether your testosterone levels are floating around and able to be active. So you should have something that's called sex hormone binding globule, it's a mouthful, at a level that subdues the actions of the excess testosterone. The other way, it's pretty obvious. If you've got a face full of hair and your body's covered, something has to be causing that. If you've got acne that is going through to when you're an adult and doesn't go away, there's got to be a reason for that. And the stats are pretty much between about 30 and 60% of women with adult acne, and those with excessive hair growth have PCOS. So it really should be a red flag. If a woman's coming in and has noticeable acne and excessive hair growth, then the doctor should automatically think, okay, I need to ask her some more questions. Maybe we need to do some additional tests. So that's the first point. The second, and this is where women can get caught up, is polycystic ovaries on ultrasound. You can pick them up on MRI, but usually on ultrasound. So they call it the string of pearls, and your ovary looks like it's got little holes, what they call cysts, around the edge. They're not actually cysts, they're immature follicles, because we can't create an egg to release often, and we end up with this gorgeous looking look. You can, at the moment, have PCO and not have PCOS. I think that it's a spectrum. So if you have PCO, you're probably more predisposed to having PCOS. So at the moment that doesn't fit the criteria. It's just, do you have PCO on ultrasound? Yes, no. The third thing is, do you have an irregular period? I didn't have a natural period for 15 years, which is, that's on the far end of the spectrum. But lots of women with PCOS don't have a regular period. Now, that usually means that there's like extended breaks where you don't have a period at all for months, more than 35 days, although in many cases it's months and months and months. Some women have periods, more than every 21 days, which is crazy and exhausting and leads to anemia and all kinds of things. So to fulfill the actual diagnosis for PCOS, you need to tick off two of those three things. So high androgen levels, irregular or absent periods, and polycystic ovaries. That's it. That's the diagnosis. So I think that it shouldn't be so hard. It should be pretty easy for doctors to have a conversation, even if they have a conversation with every woman that's coming to, their later teens and early 20s. Every woman, there was a study that looked at Spanish women, and 28% of obese women had PCOS. So it should be something that's asked all of the time. I don't understand why it's left until a woman can't get pregnant. but anyway, it is. I'm working on changing this. The other thing is that, and there is talk about this, about talking about inclusion of metabolic syndrome in the diagnosis of PCOS. We're not there yet, we should be. So insulin resistance is really common. Anyone who's been following my rantings for a while will know that I talk about this a lot. I remember one woman coming in, she was having trouble becoming pregnant, and the doctors had told her that her blood was fine, that her blood sugars were fine, and I didn't think this was the case. So I sent her off to have a test, a proper test for insulin. So we got her to have a 2-hour glucose tolerance test. That means that they measure the blood sugar at 0, 30, 60 and 120 minutes. I also had them do an insulin test at those same points in time, and comes back and lo and behold, she's off the scale. Her insulin was crazy. So we need to maintain our blood sugars in a really thin range, because sugar's sticky, so it's dangerous stuff. If your levels are too high, your body will produce more insulin to get that sugar out of your bloodstream and into your body. Often this works to a point where it keeps our blood sugars level, but if you don't look at the insulin, you can't see how hard it's working. So I think that insulin should be tested correctly in every woman with PCOS. The other thing is thyroid. Hyperthyroidism, so a sluggish thyroid, is really common in PCOS. We know that altered thyroid stimulating hormone occurs with, like, in conjunction of insulin resistance at 2.5. So again, it's something I see all the time. We know the research suggests that women are more likely to have hyperthyroidism, but no one really seems to test for it. So if you've got signs and symptoms, I always treat it like thyroid, like if it walks like a duck and quacks like a duck, there's a chance it's a duck, it's probably a duck. So I think these things should be tested. We also know that hyperthyroidism makes it more difficult to get pregnant. You will gain weight. Even if you do manage to conceive, it's less likely that you will actually be able to go through a healthy pregnancy. So it's really important. And the third thing that I don't actually see a lot of discussion around in the mainstream, although a lot of us who work in the natural health field certainly know this is true, gut issues. I just can't recall any woman that I've seen in practice. No, I'm not practicing now because of injury, but when I was practicing, who didn't have gut issues, significant gut issues. And when you look at how our microbiome, like all our gut bugs, we're just at the very start of understanding these billions and billions and billions of other entities that live in our body. We know that they can affect how much we can absorb our nutrients. We know that women with PCOS are more likely to have inflammation, so they need to absorb and eat more antioxidants. There was a study that showed that women with PCOS have lower levels of magnesium. So they're really important. We also know that altering gut bugs can cause insulin resistance. So if you've got gut issues, you are in very, very, very good company. This is something I've dealt with my whole life. And if I eat gluten or I have milk, I will be incredibly unwell. And I think that we need to start talking about this as well. So I just wanted to start off with the basics. And if you have any questions, I want this group to be the place where you can feel safe to be able to ask them, to get answers, to not have the judgment that exists not only in society but also in the offices of the health professionals that we go to seek help. And that's not okay. So anyway, that's enough. I was only going to come on for a few minutes. I'm nearly at 10 minutes, so I don't want to bore you all. So feel free to invite anyone that you feel could benefit from this group. And if you have any questions, just let me know, and I will see you next time. Thanks. Bye.